Sweat chloride test is used to evaluate A. Tuberculosis, B. Leprosy, C. Cystic fibrosis, D. Bronchiectasis. And the correct answer is C. Cystic fibrosis. The sweat chloride test measures the amount of chloride in sweat. Kids with cystic fibrosis can have 2 to 5 times the normal amount of chloride in their sweat. In a sweat chloride test, the skin is stimulated to produce enough sweat to be absorbed in a special collector and then analyzed. Sweat chloride test helps diagnose cystic fibrosis, an inherited disorder that makes kids sick by disrupting the normal function of epithelial cells. These cells make up the sweat glands in the skin and also line passageways inside the lungs, liver, pancreas, and digestive and reproductive systems. A ganglionosis of rectum and colon leads to A. Paget's disease, B. Hirschsprung's disease, C. Marasmus, D. GERD, gastroesophageal reflux disease. And the correct answer is B. Hirschsprung's disease. Hirschsprung's disease is a birth defect. This disorder is characterized by the absence of particular nerve cells which are called ganglions in a segment of the bowel in an infant. The absence of ganglion cells causes the muscles in the bowels to lose their ability to move stool through the intestine, which is called peristalsis. Ineffective peristalsis leads to stool backing up in the intestines. Affected individuals can develop constipation and partial or total obstruction of the bowels. Pain and discomfort can result. If not treated, a potentially serious bacterial infection may develop. Typical red currant jelly stool is seen in A. Appendicitis, B. Volvulus, C. Intussusception, D. Peptic ulcer. And the correct answer is C. Intussusception. Intussusception is a medical emergency involving obstruction of the intestine. It can be fatal if not treated. It occurs most often in children. It is a serious condition in which part of the intestine slides into an adjacent part of the intestine. This telescoping often blocks food or fluid from passing through. Intussusception also cuts off the blood supply to part of the intestine that's affected. This can lead to a tear in the bowel, that is perforation, infection and death of bowel tissue. The mucosa, that is the gut lining, is very sensitive to ischemia and responds by sloughing off into the gut. This creates the classically described red currant jelly stool, which is a mixture of sloughed mucosa, blood and mucus. Which of the following is an important aspect of RCH program? A. Safe motherhood and child survival, B. To prevent child marriage, C. To educate about hygienic practices, D. Both B and C. And the correct answer is A. Safe motherhood and child survival. RCH is an acronym for Reproductive and Child Health. It is a program that aims at combating and reducing the mortality rates of mothers, infants and children. Fusion of digits, that is fingers or toes, is called A. Polydactyly, B. Syndactyly, C. Genuvalgum, D. Genuvarum. And the correct answer is B. Syndactyly. If your child has syndactyly, it means that the fingers or toes are webbed or joined and that the condition was present at birth. Syndactyly is a fairly common congenital defect that often runs in families, affecting about 1 out of every 2,500 babies. Disease frequency is measured by A. Ratio and opinions, B. Frequency and distribution, C. Incidence and prevalence, D. Both A and B. And the correct answer is C. Incidence and prevalence. When measuring disease frequency, proportions and rates are very helpful when comparing groups because they relate to the number of people with disease to the size of the population in which they occur. Prevalence and incidence are the two fundamental measures of disease frequency. Trisomy 18 chromosome leads to A. Down's syndrome, B. Nephrotic syndrome, C. Edwards syndrome, D. Cre du Chat syndrome. And the correct answer is C. Edwards syndrome. Trisomy 18, also called Edwards syndrome, is a chromosomal condition associated with abnormalities in many parts of the body. Individuals with trisomy 18 often have slow growth before birth, that is intrauterine growth retardation, and a low birth weight. Which of the following is a feature of impaired fat absorption? A. Anorexia, B. Constipation, C. Steatorrhea, D. Anemia. And the correct answer is C. Steatorrhea. Patients often lose weight despite adequate food intake. Chronic diarrhea is the most common symptom and is what usually prompts evaluation of the patient. Steatorrhea, fatty stool, the hallmark of malabsorption, occurs when more than 7 grams per day of fat are excreted. Steatorrhea causes foul-smelling, pale, bulky and greasy stools. Which vitamin is essential for collagen synthesis? A. Vitamin A, B. Vitamin C, C. Vitamin D, D. Vitamin K. And the correct answer is B. Vitamin C. Collagen is the most abundant protein in your body, accounting for about a third of its protein composition. It has important roles including providing structure to your skin and helping your blood clot. It's one of the major building blocks of bones, skin, muscles, tendons and ligaments. Collagen is also found in many other body parts including blood vessels, corneas and teeth. Vitamin C is absolutely necessary for synthesis of collagen. Typhus fever is caused by A. Escherichia coli, B. Rickettsia prowazekii, C. Salmonella typhi, D. Staphylococcus aureus. And the correct answer is B. Rickettsia prowazekii. Epidemic typhus, also called louse-borne typhus, is an uncommon disease caused by a bacteria called Rickettsia prowazekii. Epidemic typhus is spread to people through contact with infected body lice. Jumping genes are also known as A. Transporters, B. Reservoir, C. Transposons, D. Both A and B. And the correct answer is C. Transposons. Jumping genes are also known as transposable elements or transposons. These are sequences of DNA that move or jump from one location in the genome to another. Hyaline membrane disease occur because of A. Lack of adequate blood, B. Lack of sufficient pulmonary surfactant, C. Lack of sufficient antibodies, D. Both A and C. And the correct answer is B. Lack of sufficient pulmonary surfactant. Hyaline membrane disease arises as a result of surfactant deficiency due to prematurity. Although surfactant granules can be observed in lung cells at a gestational age of 20 weeks, surfactant is not produced in sufficient amounts until 34 weeks. Lack of surfactant can result either from prematurity or less commonly from inadequate resorption of lung liquid at birth. Identify the disease condition shown below. A. Cellulitis, B. Lipoma, C. Osteoma, D. Ganglion cyst. And the correct answer is D. Ganglion cyst. A ganglion cyst is a fluid-filled bump associated with a joint or tendon sheath. They most often occur at the back of the wrist followed by the front of the wrist. Onset is often over months. Typically, there are no further symptoms. Occasionally, pain or numbness may occur. Complications may include carpal tunnel syndrome. Identify the device shown below. A. Sense-taken Blakemore tube, B. Nasogastric tube, C. Foley tube, D. Endoscope. And the correct answer is A. Sense-taken Blakemore tube. Sense-taken Blakemore tube is a red tube used to stop or slow bleeding from the esophagus and stomach due to esophageal varices. Identify the following device. A. Intrauterine device, B. Bone marrow aspiration needle, C. Knee hammer, D. Syringe. And the correct answer is B. Bone marrow aspiration needle. A bone marrow aspiration removes only the marrow. These tests are often done to find the reason for many blood disorders and may be used to find out if cancer or infection has spread to the bone marrow. Bone marrow aspiration removes only a small amount of bone marrow fluid and cells through a needle put into a bone. Identify the following diagnostic test. A. Rini test, B. Topography test, C. Refraction test, D. Weber test. And the correct answer is A. Rini test. The Rini test is used primarily to evaluate loss of hearing in one ear. It compares perception of sounds transmitted by air conduction to those transmitted by bone conduction through the mastoid. Thus, one can quickly screen for the presence of conductive hearing loss. Identify the instrument given below. A. Valsalem, B. Episiotomy scissors, C. Mayo straight scissors, D. Iris scissors. And the correct answer is B. Episiotomy scissors. Episiotomy is also known as perineotomy. It is a surgical incision of the perineum and the posterior vaginal wall generally done by a midwife or obstetrician. Episiotomy is usually performed during the second stage of labor to quickly enlarge the opening for the baby to pass through. The incision, which can be done at a 90-degree angle from the vulva towards the anus or at an angle from the posterior end of the vulva, that is mediolateral episiotomy, is performed under local anesthetic, that is pudendal anesthesia, and is sutured after delivery. Identify the instrument given below. A. Octopus tissue stabilizer, B. Central line set, C. Endotracheal tube, D. Bipolar coagulating forceps. And the correct answer is A. Octopus tissue stabilizer. Octopus tissue stabilizer is used to perform coronary artery bypass grafting. To perform accurate coronary artery bypass grafting on the beating heart, surgeons should be provided with a well-exposed and immobilized target site. Specifically, owing to the suction, this stabilizer allows displacement and rotation of the heart to present the target site, thus enabling multi-vessel revascularization. The Octopus tissue stabilizer consists of two suction paddles that are placed in parallel on either side of the coronary artery, and it utilizes suction pressure of 300 to 400 mmHg to effectively immobilize the target site. Identify the following device. A. Oropharyngeal airway, B. Nasopharyngeal airway, C. Laryngeal mask airway. D. Endotracheal tube. And the correct answer is B. Nasopharyngeal airway. Nasopharyngeal airways are used to keep the airway open and can be used with patients who are conscious or semi-conscious. Identify the following disease condition. A. Subdural hemorrhage. B. Bell's palsy. C. Hydrocephalus. D. Rhinitis. And the correct answer is B. Bell's palsy. Bell's palsy is an unexplained episode of facial muscle weakness or paralysis that begins suddenly and worsens over 3 to 5 days. This condition results from the damage to the 7th cranial nerve, and pain and discomfort usually occurs on one side of the face or head. Identify the procedure shown in the video. A. Tracheostomy. B. Endoscopy. C. Bronchoscopy. D. Intubation. And the correct answer is D. Intubation. The primary purposes of intubation include opening up the airway to give oxygen, anesthesia or medicine, removing blockages, helping a person breathe if they have collapsed lungs, heart failure or trauma. Name the procedure shown in the image below. A. AV fistula. B. Skin grafting. C. Plaster of Paris. D. Epsom salt dressing. And the correct answer is B. Skin grafting. Identify the following procedure. A. Thoracentesis. B. Endoscopy. C. Colonoscopy. D. Spinal fluid analysis. And the answer is A. Thoracentesis. Thoracentesis is also known as thoracocentesis or pleural tap. Pleural space is present between the lungs and chest wall. If there is excess fluid in the pleural space, it can compress the lungs and cause difficulty breathing. In thoracocentesis, a needle or cannula is carefully introduced into the pleural space to drain the excess accumulated fluid, and thereby making it easier for you to breathe again. Name the following instrument. A. Sponge holding forceps. B. Magill forceps. C. Needle holder. D. Chittle forceps. And the answer is B. Magill forceps. Magill forceps are angled forceps used to guide a tracheal tube into the larynx or a nasogastric tube into the esophagus under direct vision. They are also used to remove foreign bodies. Name the following procedure. A. Thoracentesis. B. Endoscopy. C. Lumbar puncture. D. Central line insertion. And the answer is C. Lumbar puncture. A lumbar puncture is also called spinal tap. It is performed in your lower back in the lumbar region. During a lumbar puncture, a needle is inserted between the two lumbar bones to remove a sample of cerebrospinal fluid. This is the fluid that surrounds your brain and spinal cord to protect them from injury. The main reason for a lumbar puncture is to help diagnose diseases of the central nervous system, including the brain and spine. Identify the device shown below. A. Endotracheal tube. B. Laryngoscope. C. Oxygen face mask. D. AIIMS. And the answer is D. AIIMS. AIIMS stands for Air Mask Bag Unit or Artificial Manual Breathing Unit. AIIMS is a handheld device commonly used to provide positive pressure ventilation to patients who are not breathing or not breathing adequately. Identify the machine. A. Mechanical ventilator. B. Dialysis machine. C. Ultrasound machine. D. Phototherapy machine. And the answer is B. Dialysis machine. Dialysis machine removes excess water, solutes and toxins from blood in people whose kidneys can no longer perform these functions naturally. This is referred to as renal replacement therapy. Identify the equipment below. A. Endotracheal tube. B. Laryngeal mask airway. C. AIIMS. D. Laryngoscope. And the answer is A. Endotracheal tube. The endotracheal tube is a plastic tube which is placed into the trachea. The primary purpose of endotracheal tube is establishing and maintaining a clear airway and to ensure adequate exchange of oxygen and carbon dioxide. Name the instrument shown below. A. Chittle forceps. B. Speculum. C. Retractor. D. Thumb forceps. And the answer is A. Chittle forceps. Chittle forceps is also called chittle sterilizer forceps. Chittle sterilizer forceps are used to remove sterilized instruments from boilers and formalin cabinets. They are used to ensure that as each item is removed, others are not infected. The forceps are placed in a container of methylated spirits when not in use. Identify the machine shown below. A. Syringe pump. B. Blood warmer. C. Infusion pump. D. DVT pump. And the answer is C. Infusion pump. An infusion pump is a medical device that delivers fluids such as nutrients and medications into a patient's body in controlled amounts. By using normal IV drip, the flow rate cannot be controlled. But by using infusion pump, the flow rate can be controlled as per requirement. Name the device in the image below. A. Syringe pump. B. Blood warmer. C. Infusion pump. D. DVT pump. And the answer is A. Syringe pump. Syringe pump is also called syringe driver. Syringe pump is a small infusion pump used to gradually administer small amounts of fluid to a patient. Identify the equipment below. A. Endotracheal tube. B. Riles tube. C. Tracheostomy tube. D. Feeding tube. And the answer is C. Tracheostomy tube. A tracheostomy tube is a curved tube that is inserted into the tracheostomy stoma, that is, the hole made in the neck and windpipe. Name the device below. A. Laryngeal mask airway. B. Oropharyngeal airway. C. Bronchoscope. D. CVP manometer. And the answer is A. Laryngeal mask airway. Laryngeal mask airway is composed of an airway tube that connects to an elliptical mask with a cuff which is inserted through the patient's mouth down the windpipe. Once placed inside, forms an airtight seal on the top of the glottis, unlike tracheal tubes which pass through the glottis, allowing a secure airway to be managed by a healthcare provider. Identify the device given below. A. Cuff manometer. B. Sphygmomanometer. C. Pulse oximeter. D. Thermometer. And the answer is C. Pulse oximeter. A pulse oximeter is a small, lightweight device used to monitor the amount of oxygen carried in the body. This non-invasive tool attaches painlessly to the fingertip, sending two wavelengths of light through the finger to measure your pulse rate and how much oxygen is in your system. Recognize the device given below. A. Bronchoscope. B. Cystoscope. C. Ophthalmoscope. D. Laryngoscope. And the answer is C. Ophthalmoscope. Ophthalmoscope is used to see the retina, the optic disc and blood vessels of the eye. It helps to check for diseases and other eye problems. It can be done as part of an eye examination and may be done as part of a routine physical examination. Name the equipment shown below. A. ECG machine. B. Suction machine. C. Ultrasound machine. D. X-ray machine. And the answer is B. Suction machine. Suctioning machine may be used to clear the airway of blood, saliva, vomit or other secretions so that the patient may breathe. Suctioning can prevent pulmonary aspiration which can lead to lung infections. In pulmonary hygiene, suction is used to remove fluids from the airways to facilitate breathing and prevent growth of microorganisms. Identify the type of ventilation used in the image given below. A. Non-invasive mechanical ventilation. B. Invasive mechanical ventilation. C. Tracheostomy. D. Artificial manual breathing unit. And the answer is A. Non-invasive mechanical ventilation. Non-invasive mechanical ventilation is the technique of delivering mechanical ventilation without endotracheal intubation or tracheostomy, and thus avoiding the complications which can be caused due to endotracheal intubation or tracheostomy. Identify the device shown in the image below. A. Gyroscope. B. Ophthalmoscope. C. Laryngoscope. D. Bronchoscope. And the answer is C. Laryngoscope. The prefix laryngo means larynx, and the suffix scope means any instrument used to view or observe. Laryngoscope is used to view larynx, a part of the throat, to view, for example, vocal folds and the glottis. Laryngoscope helps in endotracheal intubation and also in visualizing larynx during other procedures. Name the following maneuver. A. Head tilt chin lift maneuver. B. Heimlich maneuver. C. Jaw thrust maneuver. D. Leopold's maneuver. And the correct answer is C. Jaw thrust maneuver. The jaw thrust maneuver is a first aid and medical procedure used to prevent the tongue from obstructing the upper airways. The jaw thrust maneuver is often used on patients with cervical neck problems or suspected cervical spine injury. The maneuver is used on a supine patient. Identify the instrument given below. A. Alice forceps. B. Valsalem. C. Sponge holding forceps. D. Artery forceps. And the correct answer is B. Valsalem. Valsalem forceps have hooks at tip of each blade and are often used in obstetrics and gynecology procedures such as episiotomy, hysterectomy, or dilation and curettage. The patient is suffering from A. Albinism, B. Contact dermatitis, C. Vitiligo, D. Tinea infection. And the correct answer is C. Vitiligo. Vitiligo is the long-term condition where pale white patches develop on the skin. It's caused by the lack of melanin, which is the pigment in skin. Vitiligo can affect any area of skin, but it commonly happens on the face, neck and hands and in skin creases. The pale areas of skin are more vulnerable to sunburn, so it's important to take extra care when in the sun and use a sunscreen with a high sun protection factor. The child is suffering from A. Down syndrome, B. Turner syndrome, C. Progeria, D. Wilson's disease. And the correct answer is C. Progeria. Progeria, also known as Hutchinson-Gilford progeria syndrome, is a rare genetic condition that causes a child's body to age fast. Most kids with progeria do not live past age 13. The disease affects both sexes and all races equally. It affects about 1 in every 4 million births worldwide. Identify the procedure shown in the image below. A. Renal biopsy, B. Thoracentesis, C. Lumbar puncture, D. Mammography. And the correct answer is A. Renal biopsy. A renal biopsy is a procedure used to extract kidney tissue for laboratory analysis. The word renal describes the kidneys, so a renal biopsy is called a kidney biopsy. The test helps your doctor identify the type of kidney disease you have, how severe it is, and the best treatment for it. Identify the machine in the image given below. A. DVT prevention pump, B. Portable ventilator, C. Suction machine, D. Ultrasound machine. And the correct answer is A. DVT prevention pump. Intermittent pneumatic compression devices are used to help prevent blood clots in the deep veins of the legs. The devices use cuffs around the legs that fill with air and squeeze your legs. This increases blood flow through the veins of your legs and helps prevent blood clots. Recognize the device given below. A. Infantometer, B. Stadiometer, C. Speedometer, D. Tonometer. And the correct answer is A. Infantometer. Infantometer is an instrument for measuring the size of young children. Identify the device shown below. A. Bain circuit, B. Ambu bag, C. Suction catheter, D. Foley catheter. And the correct answer is A. Bain circuit. Bain circuit is used for delivering oxygen and anesthetic agents and to eliminate carbon dioxide during anesthesia. It is also preferred for use during transporting any critically ill patients. Identify the following instrument in the image given below. A. Otoscope, B. Tonometer, C. Ophthalmoscope, D. Cuff manometer. And the correct answer is A. Otoscope. An otoscope is a medical instrument used by a doctor to examine the ear. The otoscope magnifies the inside of the ear to detect problems or issues with the outer and middle ears such as swimmer's ear, earwax buildup, or otitis media. It generally has a magnifying glass, a cone-shaped speculum at the end of the tube, and a light source illuminates specific areas of the ear. Recognize the device given below. A. Mercury thermometer, B. Fetoscope, C. Tympanic thermometer, D. Glucometer. And the correct answer is C. Tympanic thermometer. Tympanic thermometers are usually small handheld devices with a probe that is inserted into the patient's ear canal, at the end of which is the tympanic membrane, a thin structure which is well perfused with blood. Identify the type of dressing shown below. A. Positive pressure dressing, B. Negative pressure dressing, C. Sponge dressing, D. Foam dressing. And the correct answer is B. Negative pressure dressing. Negative pressure wound therapy is a method of drawing out fluid and infection from a wound to help it heal. A special dressing is sealed over the wound and a gentle vacuum pump is attached. Identify the disease condition. A. Hydrocephalus. B. Spina bifida. C. Meningioma. D. Meningitis. And the correct answer is B. Spina bifida. Spina bifida is a birth defect in which a developing baby's spinal cord fails to develop or close properly while in the womb. Name the equipment given below. A. Tongue depressor. B. Laryngoscope. C. Colonoscope. D. Endoscope. And the correct answer is B. Laryngoscope. Laryngoscope is used as the primary tool for examination of the interior of the larynx and for placement of an endotracheal tube.